Good morning and welcome to your Weekend Healthy Chat. I'm your host, Dr. Sara, and today we have Cathy Weber and Bill Ruggles from the Lend a Hand for Kids campaign. Good morning and welcome.
Good morning.
Good morning. Well, let's get started. So tell me a little bit, what is the Lend a Hand for Kids campaign all about?
The Lend a Hand for Kids campaign kicked off in July, formally kicked off in July. It is designed to have focus on pediatric emergency department dedicated strictly for pediatrics, so it's not blended in there. We're looking to address the needs of these children in our community, so they're not sent to out of area to Westchester. Number of children that currently go out for the hour-plus ride for medical service that we can provide locally.
And where is this located at? Where is the Lend a Hand to Kids campaign? Which hospital is it associated with, since I know we didn't bring that up yet?
Well, Orange Regional Medical Center has embarked on a 3-year campaign or a project to build a new pediatric center. It's not exactly a freestanding brick-and-mortar pediatric center, but we are utilizing our beautiful new building that we opened 2 years ago. And within its walls, we're expanding our pediatric services at Orange Regional.
Great. Now, what does the 3-year plan involve, now that you brought that up?
You want to address it, Bill?
Well, you can take it with, I don't have my glasses on.
Oh. All right. Well, in the first year, which we've already begun, we're building a dedicated pediatric ED. It's housed within the emergency department we now have at Orange Regional. But it will be locked off from the rest of the ED. It'll be a safe environment, child-friendly for children who visit the emergency department. It will consist of 10 pediatric treatment areas.
Great.
It'll
that's a nice size unit. You have 10,
It's pretty large.
That's our first phase, right?
Yeah, first phase. And we also have a triage area within that unit and a nurse's station.
Great.
That's due to be open, November? Bill,
November,
right?
yeah. That's what we're talking. And it's moving right on.
That's great. So what are the other phases?
Additional to that, we're bringing on some pediatric subspecialties to the hospital that we don't have right now, which would include pediatric anesthesia, pediatric urology, and neurology units. Also orthopedics, I believe anesthesiologists, and some specialized staff, including hospitalists, which we now already have on board, which is great because then when pediatricians like yourself refer patients to our hospital, you don't have to worry that they're not being taken care of when you're with your patients at your office.
No, that sounds like they'd be very well taken care of.
Yeah, so we're very excited about that. So this is the first year, and those are the things that we're working on right now.
It's an exciting campaign. I'm privileged to be able to co-chair it with Dr. Eric Pepke, who is a pediatric cardiologist.
I know him very well. We're always communicating
Eric is just
back
a great
forth.
guy.
Yeah.
And he's been all for this for quite a while, be able to articulate the program, get it off the ground, and it's moving forward.
That's great. So how did you find your way to this program? Like, what got you inspired to be a part of this?
For me personally, my involvement came when my son got sick. I lost my son when he was 11 years old. It was a catastrophic diagnosis out of the blue, completely stunned. 11-year-old little boy, one day just was swimming in the neighbor's pool, and we had overwhelming fatigue and diagnosis. He was diagnosed in September, and he passed in April. And in that period of time, we had moments of incredible hope, and then setback and multiple trips for a number of different checkups, procedures, and all of them had to take place in Westchester.
So that was quite the commute.
It was, and if you look at the timing from September to April, that's rough weather to go an hour plus. And there were certain areas, due to the catastrophic nature, there's some specialists I needed to see in Westchester, but there were a number of other services that we have a great hospital. We had areas that could have been addressed here. And so if it means even keeping your son or daughter closer to home for a little bit more in the community and families that they've grown up with. There's a comfort factor, and it takes the stress off the family and the transport. Yeah. So, in an effort to do that, my wife and I have been involved with trying to bring these services a little bit closer. If it helps one family, that's been worth it.
That's great, and we certainly thank you for that. It sounds like you're very compassionate about the project, very passionate.
I've been very fortunate to be involved with some incredibly dynamic people, incredibly dedicated, and to be able to bring these services, to actually see this moving forward. And everybody's been on board with it. It takes on a energy of its own, when people start to get involved with it. So it's how I remember my son.
That's great in that aspect. Now, I know a big topic is having the center be family-oriented. So what does that mean, and how is it going to be family-oriented?
We're pretty much family-oriented right now. Mm-hmm. I mean, honestly,
Can the family spend the night if their child is admitted?
Yes. We have a unit. We refer to it as 5 West, which is on the 5th floor, and it's a pediatric unit, which we'll be expanding on as we go through this process of building the new pediatric center. But for now, if a child is admitted and is there as a patient, the parents can stay 24/7. We make accommodations for them to stay overnight. Great. We provide them with meals. We have our dietary service has menu for children, and then we have a menu for adults, obviously, and they can stay right there and dine together.
That's great.
And sleep there, stay overnight. If they or one of them has to go home for the evening, they have access to the nurse's station 24/7. They can call anytime.
Now, that's great. And definitely very helpful being a parent of someone if they were sick. That works out phenomenal. Now, I know that there's also a procedure room, is what I've been told there. So what type of procedures happen on 5 West?
There's a procedure room on 5 West, and there's also a procedure room in the ED, but we'll address the one on 5 West, which is the pediatric inpatient unit. It's a hygienically controlled environment. So if a child needs to have something invasive done, they're taken from their room where they're sleeping and playing and being there with their parents into this procedure room. And so anything that's painful or painful interaction happens in that procedure room, not in the room where they're sleeping or they're living while they're
you don't associate.
Yes,
absolutely.
so you don't associate it with anything.
So that way that room that they're staying in is more of a friendly feel to it versus the actual procedure room. They don't want to feel they're being tortured each time they come into that room. No, that's great. And what type of procedures are being done? Is that like a lumbar puncture?
Well, you're
IVs,
you're a
that
pediatrician,
kind of,
you know.
all of that
tell
kind
us
of stuff.
What the invasive procedures are. IVs, obviously, catheters.
Just the
basic, if drawing blood, I suppose. Anything like that.
So any type of procedure would be done outside of the child's room, and that's great. Yes. That's definitely a nice thing to have.
What does not happen in their room where they're staying.
I'm sure that puts many families as well as the little ones at ease knowing that.
Right.
So that's good.
And I learned something because you asked me about it for this interview, and so I was glad to do the research because now I really understand more about what's going to happen with that room myself.
Yeah. We'll be right back after this to continue our discussion about the Lend a Hand for Kids campaign. Welcome back. I'm here with Cathy Weber as well as Bill Ruggles, and we're discussing the Lend a Hand for Kids program, or Kids campaign, I should say. So let's talk a little bit about the layout of the ER. So I know you said we're hoping that it opens in November. So what would that look like? Or how does the layout look like?
The layout is a renovation of the emergency department. So you'll hear me reference as the ED or whatever. That's the emergency department. So as you come in, there'll be a separate entrance, a wall with artist rendition of wildlife, animals that are indigenous to Hudson Valley.
Making it very kid-friendly.
Very kid-friendly. As you walk in, along the floor is a trunk of a tree, and it branches out to the individual rooms with the different animals in each individual room.
Nice.
It will be separated from the emergency department. So as we mentioned earlier, there's many times adult situations going on in a mixture in the emergency department.
That aren't appropriate for kids.
That aren't appropriate. Absolutely. And this will be triaged separately, placed in here, and very kid-friendly.
No, that sounds excellent. Are there areas in the ER as well as up on 5 West for kids to play? So to make it more like home situation versus actually being admitted to a big scary hospital, if you will.
If the children are well enough to come out of their rooms, then we do have a beautiful playroom on 5 West. And if they're not well enough, then we have mobile carts that can be wheeled into the rooms, and they have the PlayStation on them.
Oh, nice!
And other games and puzzles and books. We have a lot of actually groups, right, Bill?
Yes.
Girl Scouts, Boy Scouts, schools, police departments. Parent-teacher groups that want to help and do something for children, and they'll donate coloring books, crayons, activity books.
That's great.
Cards, games, things that the children can play by themselves. So we have a lot of those things that we can take into the rooms for them to play.
Yeah, in the community, the National Honor Society, Key Clubs, these type of things that will carry that theme and be able to participate.
No, that's
and contribute
great.
in
Absolutely.
this area.
And then down in the emergency department, we also have a separate playroom for children, and it can be used by siblings also if they're waiting, for their sister or brother to be looked at by the doctor. So, yes.
Now, I know a big up-and-coming thing is something called a child life specialist. Can you talk to us a little bit about what that is and if that's going to be offered at Orange Regional?
Everyone asks us what a child life specialist is, and I guess I'm just going to read to you because it's hard for me to verbalize all of it, but the interventions that a child life specialist helps with at the hospital include encouraging parent presence and participation in any care that's given, showing parents how to participate and be involved in the care of their child, talking and communicating frequently with the patients in a calm manner. They also will train the staff of Orange Regional how to be child-friendly and how to talk to children if they're sick or if you have to administer any medications or treatment. They also advocate for pain management strategies to prevent children from being, in any discomfort or pain, that sort of thing.
That's great.
So they're going to have that for the children.
No, absolutely. And where I had trained with a group that was at a children's hospital, and they provide such a level of care and such a service to the families. It's amazing. I think that's wonderful. Are we going to have it both in the ER as well as in the 5 West?
He or she will be throughout the hospital.
Great.
Because, there are all different areas of our hospital where children will be, and all our entire staff of 2,000 is going to have to know how to deal with children.
The child life specialist is an area that I did not have when my son was sick. And you are plunged. I taught for 32 years. I'm a teacher, and I'm fully comfortable in the educational institutions, classrooms. I've worked with a number of kids. I have a ball, and I enjoy teaching a lot.
Yeah.
I was plunged into a world that I was not familiar with in the medical field.
Completely out of the element.
And I had to connect the dots on my own to figure out what's going on, to help assemble a team, to be able to know what resources were available. So a child life specialist is a person who is just a tremendous resource to be able to put those together.
To be an advocate for the parents as well as the child.
And to help with the communication, what's going where. You are lurching in the dark, trying to figure out what's the next move, and just the unknown is many times more troubling than dealing with what we've got to deal with, and just be able to articulate what the procedures are and why it is what it is.
Yeah. There'll be a tremendous help to our patient advocates as well. We have 3 patient advocates on staff at Orange Regional that help adults, manage their way through the healthcare system, which can be very confusing. Right?
Absolutely.
So now with the child life specialist, it'll just be another great.
It's definitely a great program that I think is only going to grow tremendously.
We're very excited about it. I'm excited with it. I know Eric is. I mean, both of us had met many years before, and was able to work with him on this project. So it's really, really exciting.
God, no, it sounds like an excellent project. So. Now, what is the project budget for the new pediatric center, and how are the funds being drawn in?
I don't have the numbers for the budget for the pediatric center, but I can tell you that this project is going to cost $10 million. And the community's part in it which Bill and I are working on, is a $2 million commitment. So what we're trying to do is raise $2 million from members of the community, our Orange Regional staff, who, by the way, have already donated $176,000
That's
from
amazing.
paycheck.
Amazing.
And I said medical staff.
Yep.
And community folks.
Our foundation board.
Foundation board is at 100%, right, Bill?
I
of
believe
giving so far.
Wow.
We are asking our board of directors for the hospital to we're trying to get 100% from them. And various civic and community groups, anyone who wants to help us with this, who loves children and just wants to see this new pediatric center completed, I have no doubt we're going to reach our $2 million. No problem.
Great. So now if people that are listening that are out there and want to help, how do they get in contact with the campaign?
Well, it's very easy if you have a phone.
Exactly.
Because our phone number is very easy to remember. We're in the 845 area code, obviously, and it's 333-2333.
Oh, that is very easy.
Yeah.
And do they ask for either yourself or Bill?
Whomever answers the phone
That's right.
can help them, and we'll direct them to either Bill or myself or someone who can just reach out and find out what they can do to help us.
Great. And does that work for, I know you said you have different groups who volunteer, whether it be items or actually volunteer there. Would that work the same way if there's different groups who want to volunteer services or volunteer like the coloring books or the crayons or different toys, stuff like that?
Well, that's the phone number for the Orange Regional Medical Center Foundation, and we're a great resource for the entire hospital. So anyone who has a question about anything can feel free to call that number 333-2333 anytime. And if we can't help them in the foundation, we'll direct them to the right place. You speak about volunteers. We have a separate department within Orange Regional Medical Center where we train volunteers to work in the hospital. It's a very it's a 10-week training program that our volunteers have to go through, and Deb Lincoln is the director of our volunteer program, and we would direct anyone who wants to volunteer to her, and she'll train them and get them set up for Monday through Sunday.
That's how I got my start, was volunteering at Bon Secours Medical Center.
It?
Yeah. Many, many moons ago. We won't get into that now. But before we wrap it up, is there anything else we'd like to say about this wonderful campaign?
The website has the renditions of how the pediatric emergency room will look. That's very exciting to be able to see that. And we have the layout here and some of the things that we've mentioned earlier with the artistry, and each room is set up with the wildlife theme through it. In addition to that, there is more in-depth information on the Lend a Hand for Kids campaign. We have the video, which involves Dr. Cathy, myself, and a number of other key players in the campaign. We highly encourage people to take a look and explore that. And there's also an area where you can contribute, right? It's given on the website.
And what is the website?
It's www.ormc.org, and you'll see the foundation area of that website. You click on it, it'll take you right to all the information about the Lend a Hand for Kids campaign. There's also on our homepage of www.ormc.org, there is a, what do you call the little box? It says Lend a Hand for Kids, and you click on it. The IT term I can't think of right now.
A little icon, maybe?
Yeah, icon, yes, and it'll take you right to all the information about our campaign.
Well, that's great. Well, I just want to thank you both for being here, and you both are doing such a tremendous service to the community. So
and the community's been incredibly supportive. I think it'll only grow in its support, and people in your audience here, we could certainly, any way they can help us is just one more step closer to putting this together.
Well, thank you both for your commitment. We appreciate you being here.
Can I just say one more thing?
Absolutely.
Won't you lend a hand for kids?
That's a campaign.
Well, we will be right back after this. Welcome back. Now it's time for our email question of the week. A near expectant mother writes, Dr. Sara, can you offer family members some good tips on preparing for the new arrival? Sometimes even husbands can be clueless on the topic, and this can create issues unnecessarily. Well, thank you so much for your question. I'm sure there are many tips out there on preparing for your little one, but the best advice I can give is to enjoy this time. Spend quality time together as a family before the little one arrives. Prepare together. Make sure you have everything your little one will need for the first few weeks, whether this is car seats, cribs, bottles, blankets. Go shopping together. Anticipate the arrival together. This is an exciting time, but also nerve-wracking, as any change can be stressful. But try to enjoy the preparation, because I promise you, your lives will never be the same again, but it will all be for the better. I hope this helps, and congratulations on your new arrival. For those of you with further email questions, please feel free to email me at drsara@middletowncHC.org. Again, that's DRSARA@middletowncHC.org. I'd like to again thank Cathy and Bill for being here to discuss Lend a Hand for Kids campaign. It was great to have them both on the show. I hope everyone has an active and healthy week ahead, and I'll see you again next week. Thank you.